things that are relevant to processing low-income subsidy applications today. I'm Donna Delichat. I'm a field officer with the Oregon SHIBA State Office. And joining us today is Janet Bowman. She is the coordinator for the MIPPA grant. And Janet, you want to tell a little bit about yourself?
Sure. Mostly we're working with this grant, which is to sort of gather everyone together, not just the SHIBAs, but also the area agencies on aging and the ADRCs around the state for one main purpose, which is to try and help people with low income and limited resources to get the help they need in terms of Medicare resources that they're eligible for. As we look around us today, as we're recording this webinar, it's snowing and it's icky outside and it's cold. And one of the things that we can do just by participating in this grant and helping people with LIS and Medicare Savings Program is to help people save enough money that, gosh, maybe $100 a month is a heating bill. Maybe it's enough to help pay for groceries. It's a variety of things that people can do other than pay for drugs, expensive costs, or their Medicare Part B premium. And so if they qualify, that's something that we can help with, and this webinar is to show you how to do that.
Absolutely right. And going on to the agenda on slide 2, we're going to cover a brief overview of what the low-income subsidy, otherwise known as LIS, is, and how it works with the Part D Medicare prescription drug program, and how to screen clients for their eligibility. And then we'll do a quick review of the Medicare Savings Program. We have some new numbers for eligibility, just came out January 2014, and how that works with Medicare and screening clients for eligibility. Then we'll actually go through a processing of an application using the benefitscheckup.org website, which is the portal that we would like all applications run through because it gives us visibility as to how many applications have been filed. Then if you are a SHIBA and you're entering client contacts, we'll spend some time looking at how the client contact needs to be completed in order for us to have correct accounting for those applications and those screenings. Then Janet's going to talk a little bit about a new 1-800 line that the state is implementing as a part of this grant and how to and when to refer a client. So going on to slide 3. What is a low-income subsidy? Well, LIS is a federal assistance program. It was started with the beginning of the Part B prescription drug program in 2006, and it helps folks who cannot afford to purchase that insurance and or their medications by allowing folks to get a subsidy towards that premium price of that insurance and a lower copay. The only entity that is processing these applications is Social Security Administration. They determine eligibility, and you give permission with your application for the Social Security worker to look at all of your statements, either through Social Security income statements, IRS returns, whatever it happens to be, in order to determine whether or not you are eligible. When somebody is found eligible for LIS, the average value of that eligibility is about $4,000 a year. When you look at the standard Part D benefit, you can see that in order to get to catastrophic coverage, where there's only a 5% out-of-pocket coinsurance by the beneficiary, you have to spend about $4,550. So to help folks that don't have that kind of resource to pay for those medications, it's giving that additional benefit up front. So the value is about $4,000 a year. Going on to slide 4. When somebody applies for low-income subsidy, as I mentioned before, it gives them access to the drug insurance, which otherwise they may not have been able to afford. Right now, I believe the subsidy toward a Part D insurance premium is about $38 and some cents. So it allows folks who may otherwise not have enrolled in a prescription drug insurance plan to get that insurance at zero cost, because there are several plans available in the state that allow that $38 subsidy to be the sum total of their premium. It also protects people from their coverage gap, where the cost sharing increases. Right now it's about 50%, 47.5% for brand name drugs and 72% for generic drugs. So when you are in a Part D, when you're in an LIS program, those coverage gap cost shares are waived. It also waives any late enrollment penalty premium. I had a client just the other day who at 70 had never signed up for Part B, didn't think he could afford it, didn't really need it at the time, but did eventually decide that he needed to get into it because his circumstances had changed. He was looking at a 5-year penalty, but when we talked further, he was eligible for the subsidy, and so once we got him enrolled in, or applied for the subsidy, he was able to enroll, and that late enrollment penalty went away. It also allows folks who maybe their circumstances are changing from month to month. Maybe they've got some health concerns, and maybe their plan is not going to offer the same kind of coverage based on their new circumstances. So it allows folks to have a continuous special enrollment period, which means they can change plans anytime throughout the year. They are not required to wait till that fall open enrollment or annual enrollment period. They can change plans as often as every month. Of course, we don't recommend that. All of these data systems do take time to percolate through the various channels, and so sometimes that can really mess things up. But if they do have a change in circumstances, or they're not satisfied with the way their plan is currently covering their prescriptions, then we can help get them into a plan that is going to be a better fit for them.
One thing, too, Donna, that's nice about that special enrollment period is that with the Medicare Part D, it's not just for a PDP or standalone Part D plan. Anything that contains Part D, which is a Medicare Advantage plan as well, you can change plans into one of those, or out of one of those into PDP as often as every month as needed in order to get the coverage that's the best for medications.
Yeah, that's a very good point. So if someone is in just a standalone drug plan and maybe they're having a hard time getting access to care through a physician, they could switch to an MAPD, a Medicare Advantage with drug coverage, and then they would have an access to the doctors that are in that network. That's a good point. Thank you, Janet. Let's move on to slide 5. When we're talking about the different types of assistance with the subsidy, there are 2 levels. The full health subsidy is for those folks who have lower incomes and fewer resources, and partial health, otherwise known as level 4 benefits, are those with slightly higher incomes and resources. We do have in our SHIBA training some specific examples of the partial health level 4, because it works a little bit differently. It's for folks who have incomes between the 136 and 150% FPL levels. Both those full and partial health subsidies, however, do eliminate the coverage gap. So there's no difference in the coverage gap or the late enrollment penalty or the SEP for making changes throughout the year. The only difference is the amount of subsidy that goes towards their prescriptions. Anything else you want to add on this one, Janet?
I guess when you take a look at the Part D coverage gap and that level 4 or partial help for the folks who are between 135 and 150% federal poverty, you'll see on different charts that they have a 15% co-insurance throughout different sections of, you know, like they don't have a coverage gap, that they have a 15% co-insurance instead of a set $2.55 or $6.35. That is confusing to some people because they think, well, gosh, well, I'm still paying something. That must mean that I'm still, you know, I'm in the gap. But no, it does eliminate that kind of big burden on them that people without LIS still have to pay.
Right. They're paying 15% instead of the higher amount, 47.5% for brand names and 72% for the generics. Absolutely right. Let's move on to slide 6. When you're screening a client for subsidy, they must be enrolled in Medicare first off, but they don't have to be enrolled in both A and B. They can be enrolled in A or B. When you're looking at their financial eligibility, it all has to do with the federal poverty levels and whether or not they have any liquidable assets that are available to them. So we're going to see on the next slide some numbers, but don't be hung up on the numbers because sometimes people's circumstances are different that they would be eligible. I have had a couple of clients that surprised me. You know, they had dependents at home that maybe their financial eligibility on the surface for a couple wouldn't make them eligible, but when they have dependents at home, it's a different eligibility level. So once somebody is determined eligible, then their LIS is usually good for the remainder of the calendar year. So if they're eligible in February or March of a year, but maybe later on their circumstances change, they'll get a letter in August that tells them that after December 31st they will no longer have subsidy unless they reapply and they can show that their circumstances are indeed still eligible. Some folks are deemed eligible, which means they automatically get LIS because they're below 135% of the federal poverty level. Those folks are the folks that are already enrolled in Medicaid, or they might be in an institution like a nursing home, or if they're at the level of income that is supplemental security income, or if they're enrolled in any of the Medicare savings programs. Because remember, the Medicare savings programs top out at 135%. So anybody who is at 135% or below is going to be automatically deemed eligible for this subsidy. However, just because they're deemed eligible for the subsidy doesn't mean that they're enrolled in the subsidy. So we've seen some folks that are in Medicare savings programs, and yet they're not, the system for Medicare has not updated them to be eligible for LIS. So we always recommend that we check either with Medicare to make sure that they are receiving LIS, or we go ahead and process an application, especially if they're not receiving LIS. Going on to slide 7. Here are the numbers that we said were coming up. Again, these are just guidelines. These are new income and resource limits effective January 22nd of 2014. And you can see that it does not include the person's home or the car that they drive if they own their own home. And you'll see that level 4 partial subsidy at the highest there, 135 to 150. And actually, I think that should be 136, because anybody at 135 is going to be full. Okay, slide 8. What is a Medicare savings program? Well, just like the title, it's a way to save money on your Medicare costs. It's a program that is run by the state, and it is administered by the local Aging and People with Disabilities office. It has its own eligibility determinations so that folks who are below that 135 FPL can get assistance paying for their Part B premium. If their income is at the 100% of the FPL or below, then they can have the Part B premium and the cost shares with the deductible and coinsurances, normally their responsibility on Medicare paid for by the state as well. These programs also waive any late enrollment penalty for somebody who may have delayed in enrolling in their Part B. So the state is going to pay their Part B premium, but the state is not going to pay that penalty. So it's going to allow them to get additional assistance without having to have that additional premium added for not enrolling timely. Both of these programs, or all of these programs, the QMB, SMB, or SMF, those are called SLMB or QI sometimes in the state system, automatically deems beneficiaries eligible for the subsidy. But again, we want to make sure that the folks that are deemed for these particular programs are truly signed up for their LIS subsidy as well. Go to slide 9. So when somebody is eligible for the Medicare Savings Program, MSP for short, just to recap, they are able to get assistance with their Part B premium and possibly the deductibles and coinsurance. No late enrollment penalty for the Part B, and automatically deemed eligible for LIS, although it may require some manual processing.
And just revisiting, revisiting the 2 levels of help, the full help or QMB is the one that gets the coinsurances, which is basically the remainder of what someone would be asked to pay, covered by the state. And that's something where the person who has QMB really needs to let their provider know that they have QMB. There is an 8.5 by 11 piece of paper, which is a statement of benefits that the state of Oregon will mail out to someone who has QMB. And in the corner of that is a pocket-sized card that they cut out and carry. It has something called a prime number, which is the state identification number. The provider, doctor's office, hospital, whatever, needs that number to go ahead and bill. And then at that point, the state reimburses for the part that Medicare does not pay. So that's for QMB. SMB or SMF, and those are state jargon. Medicare, it's known as SLMB or QI. At that level, only the Part B premium is paid.
Very good point, Janet. And for QMB folks, it's actually illegal for providers to bill the beneficiary for co-pays or co-insurances if they have given them that prime number. If the provider doesn't know that they have QMB, then they can't be held accountable. But folks that have QMB are not supposed to be billed for those co-pays or co-insurances. and it works for both Medicare Advantage plans as well as Original Medicare. Okay, let's go on to slide 10. So here's the numbers for the MSP eligibility. It's a little bit lower in some cases, particularly for the resources. One thing we want to mention here is that these income limits are not effective until 3/1 of 14. There's a little bit of a delay in order to get the cases percolated through the state system. Additionally, the resources are for folks who may have additional money set aside for burial or funeral expenses. As long as it's in a separate account, they can have up to $1,500 per person. So that is not reflected in those numbers. So if somebody, a single person at the 100% level, had $8,000 and they did not have one of those separated burial fund accounts, they could take, say, $800 out of their commingled account and set up a separate account. Doesn't mean they couldn't use it for other purposes. It just means it's not commingled with their regular assets. They could still use it if they needed it for some other purpose, but the way in order to qualify for these benefits is the $1,500 maximum per person must be separated in a separate account. And there's also 3 asterisks under the RX premium, meaning 0, if they're in a benchmark plan. A benchmark plan means those plans that have valued their premium at or below the subsidy amount. Sometimes the plans are right about at the subsidy amount within a few cents or maybe $1, and those plans have agreed to write off whatever the difference is, and they will accept whatever the subsidy amount is as full premium payment. So any of those plans that are considered in that arena are called benchmark plans. Going on to slide 11.
This is something that we have used, although I know that just about every SHIBA office has its own version of this, or different counselors have their own version of something that they use with clients to help them screen themselves for LIS or a Medicare savings program. And just, you know, as a general comment on this, by now everyone's head is swimming, even mine and Donna's, and we wrote this thing with all the different acronyms and income levels and categories and that kind of thing. Keeping it simple helps you and helps your client with not being overwhelmed and able to view clearly whether or not they're eligible for this. So for Part B help on this particular example, let's say that you haven't had someone talk to you already about what their income level is, and you haven't heard them talking about vacations in Florida and you know, their $1 million in the bank, or you know, something that would make you think that they were very wealthy. What you can say is, what we're trying to do is make sure that everyone that we speak with knows about some benefits that are available. Even if they don't apply to you, maybe they apply to someone that you know about. And what we do is we put this sheet out and say, would you say that you are, if you're a single person, would you say you're above or below this income, above or below these resources? It's an easy way for people to say, nope, doesn't look like this is something that applies to me. In that case, you've already done the screening. If you have a brochure, we'll talk about that later, we're putting brochures together. You can hand them a brochure and say, if there's someone else you know that might qualify for this help, please let them know about it. But that way, it's pretty much an easy gesture. It works, it doesn't. You don't have to go into a whole lot of detail about somebody's finances in order to help them see if they're eligible for these benefits.
Yes, and one thing I want to mention here too, Janet, is we have a lot of folks in rural places that may have large acreage, and we found out that if you have a home that you're living on and it's contiguous on that large parcel, just because you have a large parcel does not mean that you're ineligible. So one of the questions on the application is, do you own real estate? And sometimes we've even had clients, well, they inherited something from their parents and they are co-owners with their siblings. If you have real estate that is not sellable, maybe it's co-owned with two or more people and one person doesn't want to sell, then that is not a disqualifier for eligibility in these areas. So a lot of times we've had folks that thought that they would not become eligible because they had property of value that they would consider over asset, and that is not always the case.
That's a really good point, and I know that a lot of times people see a grid or a chart and they think this is, you know, something that screens me or that screens someone out, and that nothing could be further from the point here. What we're trying to do is help people see that they are, you know, screened in. And if there's something that you know, like what Donna just said about the realty and whatnot, that you can explain to someone, or even say, you know, that's something that is technical enough, why don't you give it a try? Or there's a phone number at the bottom, Oregon Medicare Savings Connect. Why don't you give these people a call and just see, give it a try. It's worth being encouraging about that in order to see if someone can get the help that they need.
Exactly. We want as many people who can qualify apply for these programs. Let's move on to slide 12. So this is the portal that we need all applications to be filed through. This is the main screen. If you see anything other than this SHIBA branded website, then you're not on the right page. So you have to go to benefitscheckup.org and put in that //Oregon in order to get to this page. The regular benefitscheckup.org homepage looks completely different, and it has a yellow button that says, do you want to, you know, check for additional benefits? And boy, I'll tell you, it takes you down a whole different road. So the quickest and easiest way to file an application for subsidy is to go to the /Oregon branded site and click on that first center Go tab there, the Medicare Extra Help, and that's going to start that process. And once you get familiar with it, a application can be completed in 15 minutes or less. It's really pretty straightforward. So we're gonna whiz through some of the screenshots on that application process just to get you familiar with it, so that the first time you do it, you don't feel like it's totally foreign. Let's go to slide 13. Once you click that, I want to apply, you're going to have this basic questionnaire. The first thing it asks is if you are helping somebody with an application. As their typist, you can say, yes, I'm going to help them, but it is your choice. If you don't want to put your name on that application as an assister, you don't have to. I always do, and I got to say, in all the years that I've been using this website, I think it's 3 or 4 now, I've never had anybody call me to find out more about the applicant. But if you don't feel comfortable with putting your name on there, you don't have to. And so basically it's just very basic questions about if they received an application in the mail. Sometimes people don't pay attention if they did, or if they did, they didn't think they were eligible, so they threw it away. And then whether or not a person is already on Medicare. Let's go on to slide 14. So this is what it looks like if you did say you wanted to be the completer of the application. I always put other because all of the other relationships to applicant are not particularly relevant to the SHIP office, and I think that the SHIP office needs to be highlighted. Probably benefits checkup or Social Security is not going to know what SHIBA is. In fact, SHIBA is the name of another state program. It's Washington State, and I don't know if Idaho, I think Alaska changed theirs now. But by saying Oregon SHIP, that is pretty specific that it is coming from the Oregon SHIBA volunteers. And I put in our 800 number and our P.O. box. And again, however you or your sponsor feel comfortable, if you want to enter this information. If you don't have to. Going on to slide 15. So you would just click no, and then it wouldn't open up that box, and you wouldn't have to fill out that additional information. Going on to slide 16. So here's where you're going to put in the person's name. Be real specific. It has to be exactly as it appears on their Social Security card, including any suffixes, junior, senior, the third, whatever. It also has to be specific to their Social Security number. So if a person is receiving their Medicare benefits under spouse's Social Security number, this is not their Social Security number. This is not the spouse's Social Security number. This is the individual's Social Security number. So a lot of times we'll see spouses that have a deceased spouse, and they're collecting their Medicare benefits under the other person's Social Security number. But that's not the case here. We want the actual person who is applying and their Social Security number, not their Medicare number. And of course, their date of birth and their mailing address, et cetera, and the phone number. And probably the only time Social Security would call somebody to find out more about this application, they would call the individual, maybe clarifying their family size, maybe clarifying the real estate situation like what I described, something that may be just a little bit outside the normal parameters of eligibility. Let's go on to the next slide. This is an opt-out box. If the box is not checked, then the application goes to the state to process for MSP application benefits. If the person is not interested or obviously does not qualify for the MSP programs, you need to check the box to opt out of having that application sent. Now, I have a particular philosophy about this box. If I have a client who is obviously eligible for the MSP benefits, checking this box, or not checking this box and letting that application trickle down through the data systems, first to Social Security and then to the state, could take 30 to 60 days before they're contacted. My clients probably want their benefits a lot sooner than that, and so I'm making a direct referral to their local Aging and People with Disabilities office. I want them to go down in the first week after talking to me to apply for those benefits, because that can make a huge difference in the time it takes to process the application for those benefits. I believe the local offices have 30 to 45 days to process those applications. So you can see how if it goes through the Social Security first and then it gets to the state and the state sends them a letter, it might be quite some time down the road before benefits are actually implemented for that person. Janet, do you want to give your experience on this?
Sure. I agree with you. It is really important if somebody needs a Medicare Savings Program, do go ahead and get them to their local Aging and People with Disabilities office so that they can apply for it now. Don't wait for this system to kind of passively do it. On the other hand, I guess my sort of bias on this is you don't necessarily have to check the opt-out box, or it's not a problem if you just sort of let it go through as is. Because once this gets to the state, and we'll talk about that processing in a few minutes, if they already have a Medicare Savings Program case or any other kind of case, the information will just be discarded. It won't be processed, so there's no problem if it's a duplication.
Good point. The cost of doing it through the Social Security first and then back to the state, is not only time. There's actually a dollar amount associated. I think it's somewhere in the $90 per person range. So if somebody is capable and motivated to go down and get those applications and benefits started sooner, then opting out is probably not only going to get their benefits started sooner, but it's also going to save a few tax bucks too. Let's move on to slide 18. This is just another screen showing about their living situation. Most of the time, folks are going to have zero because it's just one person or a couple. But if they do have dependents in the home, then this is where it could make a big difference in whether or not their income, if it's over a certain amount, could be refactored with eligibility for a higher family size. Let's go on to slide 19. This is the screen where any of their resources are going to be entered. And most folks have some sort of a bank account, so when you click on yes, it opens up a little box that says, okay, so you say yes, you have some bank accounts. How much do you have in all of your bank accounts combined? And the same goes true for any kind of stock bonds, savings bonds. Anytime you answer yes, it opens up another little line that says, okay, tell me the total that you have of value in those accounts. If you click no, obviously it's not going to open up any of those additional fields to be entered. 27, question 27 is that same question earlier that we talked about, the funeral or burial expenses. If they have a separate account or a prepaid plan, they're going to click no. If they don't have something separate, then they're not going to check anything because some of the money that they have in their current bank accounts is already going to go towards their funeral or burial expenses. And then question 28 is that one where I mentioned about, do you own any real estate? And sometimes if you do check yes, then they have additional information that you want to include in your application at the very end of the application. Do you want to add any other comments? And that might be where you say, yes, I co-own property with 3 siblings and it's not sellable at this time. That might be something that you might want to put in there.
One of the nice things about benefits checkup is see all these little boxes that say help at the end. If you have a question about how something is calculated, you can at least take a look there and see if there's some clarity about how that might work. That's a good help for you. Going just back to question 26 for a second, do you have any of the following resources? I've sure noticed that a lot of the people that we speak with tend to know pretty much exactly what's in their bank accounts or what kinds of resources that they have. But in case they don't have it down to the exact dollars and cents, we don't necessarily have to wait and have them bring back bank statements and that kind of thing in order to complete this application. Once they've signed this application, it gives Social Security permission to go ahead and take a look at IRS records and take a look at bank records and that kind of thing if verification is ever needed. But basically, their best estimate is probably going to be just fine as they're filling this out.
Yeah, one of the things I tell my clients is when the day is done and you've gotten your Social Security check and you've paid all of your regular bills like rent and utilities and stuff, how much discretionary income do you have left? That's the amount in your bank account, really. They're not looking for a specific dollar amount on any particular given day. They just really want to know what the end result is. So oftentimes they'll say, oh, you know, a couple $100, or, you know, if they have a savings account, they might have $1,500 or something. So, all right, let's go on to slide 20. That was a good point, Janet. So here's a screen of where they would put their current income. If somebody had marked on the beginning that they had any kind of wages, there would be an additional screen for wages and earnings other than this one. This one's pretty much just retirement benefits. So you can see I've selected yes on the Social Security, and it opened up that little extra field that says what do you get per month before any deductions for your Social Security, and this particular person had $1,250 in income, and they didn't have any other benefits from railroad or veterans or pensions and annuities. But you know, this is pretty self-explanatory. If you need help, like Janet said, there are help buttons, and there's even a tutorial, I believe, on benefits checkup that allows you to walk through this, or you could do a fictitious application like I did, just don't submit it at the very end, so you can kind of familiarize yourself with some of these questions. Pretty straightforward. Janet, you have any experience on this?
Well, yeah, and that is something that I went ahead and sent to all of the SHIBA coordinators a link to the tutorial. It's about a 4-minute little show on how to use benefits checkup and how this all works. But you can also go into the benefitscheckup.org/Oregon site and put in something that is clearly a test and poke around in it a little bit, see how the help boxes work, see how, you know, what drops down when you answer yes, that kind of thing. As Donna was saying earlier, just please make sure do not hit submit on that. We don't want errant data being sent off to Social Security, and in fact it might just bounce back, but you know, we don't want to go there with it anyway.
Great. Perfect. Let's go on to slide 21. When you have finished the completed application, it gives you an opportunity to review all your information. And as you scroll through that, those different modules or sections, it gives you an opportunity to edit each one. Now, we have had some folks who have used the edit function, but then they've run into problems at the end when they've tried to submit. So I haven't used the edit function maybe once or twice, and I didn't have any problems. I do know if you go back and forth too many times, the system views that as maybe somebody trying to scam the system. So it might flag it because it thinks that somebody's trying to be fraudulent. So just try and be as accurate as you can in the beginning. Of course, spelling errors or things like that, you probably should go back and correct. But you do get a chance to review information. It does give you an opportunity to go back and edit. This is the time when you want to make sure that all the information that you have typed for your client is correct. I do most of mine over the telephone. But if you're doing this in person, then the person is sitting there with you. They can look at it and verify that it is correct. Let's go on to 22. When you get that review is done and you say, okay, I'm ready to submit this, it gives you the legal ramifications. Of course, you know, everything has to have the legal spiel. So it just says, you know, that you give permission for Social Security to check statements, IRS, banking, that sort of thing, and their own records, because most people who have just Social Security retirement benefits, they have access to that, and of course the declaring under penalty of perjury. So, and then if you are listing yourself as the person who's assisting completing this form, you also need to check by your name that you are being the typist, that everything that that person has told you, you have accurately entered. So that gives you an opportunity to electronically sign these applications by checking the boxes next to the name. And slide 23. Once you get that, hit that submit button, it takes a few moments for Social Security to actually match up the person's name and their Social Security number. If the name and the Social Security number do not agree, then it's going to say you have to go back and change something in this application because they're not finding that person. It could be a middle initial is wrong, or maybe they've got a suffix, or maybe it's John spelled J-O-N instead of J-O-H-N. I've had that happen. So it does need to have exact match, but once you do get that exact match, you'll get this congratulations sign that they have identified who it is that they're applying, who is applying, and they're giving you this this receipt. This is not where you stop. Not only do you print the page, the top box there for the records that says you have actually applied, but you also need to hit View Your Submission Receipt. This is required. It has a date and a time stamp on it, and it has the applicant's name and information so that if there's anything lost in the data transmission, you have a receipt that this person actually applied. So let's look at that View Your Submission Receipt on the next slide. This is what the successful submission receipt looks like. It's going to have the applicant's name. It's going to have their Social Security number that's X'd out except for the last 4 digits, and it's going to have their date of birth and their address and telephone number. This is what the state office needs to have a copy of or the data off of it. The easiest way is to print and fax a copy of just page 1 with the applicant's name and birth date on it so that we can find out later on down the road, maybe 2 or 3 weeks, that yes, indeed, they did get approved for subsidy and they got 100% subsidy. Or yes, indeed, they got approved for subsidy and they are at level 4 with a 75% subsidy rate on their premium. So it's going to give us the way to look up this person in the MARCS system, which is a CMS, Centers for Medicare and Medicaid secure system for us that we have access to in order to see that, yes, that application has been successfully processed and they have been awarded subsidy or they've been denied. We are seeing that people sometimes, what they tell us is not entirely accurate, and the Social Security Administration finds additional income or resources, and that for whatever reason they are denied the subsidy. So that also gives us visibility into, yes, they've processed the application, but it was denied on a particular date. And on the left-hand side, I've listed the state office fax number. We do not want this information emailed. It is protected information, and fax is the most secure way to transmit this. We also have a tracking sheet that Janet has sent out. And Janet, you want to talk a little bit about that?
Sure. And we have another person who's working with us, and I don't know if it's possible to bring up the tracking sheet right now, or else we can go back and do it later. I see magic things happening with this screen, and this lady, you would love her, the one that's helping us. Anyway, so we've got something here that's called Attachment 1, Sample Tracking Sheet for LIS and MSP applications. And part of what we're talking about here is just we want to check and make sure that the people we are trying to help are getting the help that they need. You probably noticed on the submission receipt that it said the application for extra help with Medicare prescription drug costs was received by Social Security. This is real time going straight to Social Security. a lot of people are concerned that if they've gone through benefits checkup, there's a middleman or there's something like that. No, it's, it goes right straight to Social Security, no hesitation, nothing funny in the middle there. But best practice really is for someone to go ahead and once they've gone ahead and finished the enrollment process, print the first page, fax it off to Donna. If that doesn't work for some reason, if you're out in the middle of Harney County and you don't have a fax, for miles or that kind of thing, there are some other things that you can do in order to get the information. What we really need in order to do the tracking that we need to do is the client's name exactly as it's listed on the Medicare or Social Security card, which means, the middle initials, or it means the weird spellings, or it's really, with some ethnic names, it's very difficult to make sure that you've got the first name and the last name in the correct order, and, that kind of thing. So exactly as it is on the Social Security card. And what we need, other than that, really need is the date of birth, or if you couldn't get the client name exactly as, the Medicare claim number. So, that's what we're looking at. So client name, zip code would be nice, date of birth, did you apply for LIS? We assume yes, that's why you're doing that, and you use benefits checkup, of course. And did you refer for a Medicare savings program? Maybe yes, maybe no, depends on whether or not they were eligible for that. Now, we're going to be getting to something else here in a minute too, and we'll talk about that, but people with Medicare can also be referred to Oregon Medicare Savings Connect, which is the toll-free line that is connected with the MIPPA grant, and there's the phone number there, 1-855-447-0155 for screening and enrollment in case it's not something that you have time to do during the SHIBA appointment.
Yes, and if you're processing an application in any other way than through benefits checkup, because benefits checkup does keep track of all applications filed, if you're using anything like directly to Social Security or a paper application or referring somebody to the Oregon Medicare Savings Connect phone number, that number is going to need to be kept track of as well. How many people are through those alternative methods and reported to your sponsor or to Janet, because we don't have visibility into all of those applications unless they are through the benefitscheckup.org/Oregon website.
The reason this says sample tracking sheet is clearly you're going to be working with your SHIBA coordinator in order to decide what locally is the best way to get this data from your hard work into Donna Delicat's hands in order to get the tracking done.
Okay, let's go back to the slides. And we'll go on to the next screen, or the next slide. So let's talk a little bit about client contacts. Everybody has a different way to enter client contacts. Some folks enter them themselves. Some counselors enter them themselves. Some have a data entry person through their organization, and so they fill out a paper application and then they turn that in. Depending upon how your organization determines the best way to have your client contacts entered will affect how you will not affect how you enter these. So we are asking that everything get entered by the 10th of every month. CMS has made this official. We've been promoting it for the last couple of years, but starting in April, it is going to be by the 10th of every month. No longer is this by the 31st of the month following the last quarter going to be reasonable, because every month, at the end of the month, we're going to be getting reports about what our activities are and how well we're providing service to the community. So by having all of the client contacts in by the 10th of each month, it's going to make those reports much more time sensitive and accurate. When you are capturing the time spent on a client contact, make sure that you are not shortchanging yourself. If you're waiting for an appointment to show up, or if you're spending over an hour in counseling with that person, and you were only going to put down an hour, or if you were researching something after the appointment or talking with your SHIBA colleagues about a particular situation, all of this information, all of this time that you have spent on this particular client's issue is countable. So it could be that you are spending multiple hours on this person rather than just the one appointment hour that you spent. And we are finding that by and large, most of our counselors shortchange the amount of time that they report on their client contacts. They need to capture every minute that they are spending, including driving time to and from an appointment. So make sure that you give yourself credit where credit is due, and you're making sure that all of that time is allocated to that client contact on that particular day. Let's go on to slide 26. I don't know how many folks have a particular client contact form that is near and dear to their heart. I use the one-page one that is circled. We have two-page ones. We have ones that follow along with the data entry a little bit better. Some sponsors and coordinators have developed their own that they like to use. So whatever that is, we can accommodate whatever it is. The next slide we're going to see is the one-pager where one that the state office uses, and we're going to blow up those sections where the circles are. Let's go to slide 27. So on those, on that one-page client contact form, there is a section there that talks about Part D, low-income subsidy. If you are applying for somebody, certainly, you're going to make sure that you circle or enter that application assistance. And on mine, I just put on how I did it, but I always do mine through benefits checkup. But if there was a glitch in the system or something and you couldn't submit that one on benefits checkup, and maybe you had to send them to Social Security or with a paper application, you might want to mark on there as well. And certainly, you are going to also probably circle eligibility and screening, because they didn't know in the beginning that they were eligible, and you screened them, and now they are, and that's why you're applying for them. And you're explaining the benefits. So not only are you going to be circling that application assistance, but you're probably going to be entering those other two as well. Then down at the bottom of the NPR ShipTalk client contact form, there is the nationwide and CMS special use fields. When you put, it just says MIPPA at the bottom, and you're going to put in either 1, 2, or 3, or 0, 1, 0, 2, 0, 3. So if you're just applying for LIS, it's going to be 0, 1, and you're going to actually enter 0, 1 on the ShipTalk NPR form. If you're actually doing an MSP application, and for some folks who are very vigilant about their clients and they want to apply for that MSP, there is an online MSP application at the end of that benefits checkup submission. If it looks like they were eligible, they actually could go to that nth degree. But we don't request that you do that, but it's certainly up to you if you want to. And of course, 03 if you're going to do both the LIS and the MSP application. But for most people, we're just going to be doing the application assistance and the 01 for LIS.
And one other thing that we can add about that, if we can go back just to the previous slide for a second, Sue Ann, on 02, the MSP application, it also counts there if you've done significant activity in order to assist someone with an MSP application. not just if you've handed them a phone number and said, here, call these folks and make an appointment, but if you go over with them, if you help them fill out the form, provide documentation, or as Donna was telling me about earlier, if they haven't gotten benefits or haven't heard back and you call on the phone and advocate for them, that's something that you have directly done to assist in applying for the Medicare Savings Program with them. And so you can count that as well.
Yeah, good point, Janet. I forgot about that. I did have a client where she hadn't heard back from the local office, and so I made the call. That is considered having a direct hand in that person getting those benefits. And so, yes, you can add that to the special use fields, but there's also another box in that client contact form which says Medicaid, and you can have application assistance with the MSP program.
Yeah, and if we can move to the next slide, yeah, that's where we're headed next. Don't forget, you know, once you've gone through either the self-screening little sheet that we talked about, or you have looked at whatever tool you're most comfortable and familiar with and helped to screen someone for income and resources, whether or not they qualify. You know, you're going to mark these boxes whether they're below or above federal poverty level and LIS limits. And then once you've done that, and if you go to slide 29, then you mark on the Part D low-income subsidy that you have screened for eligibility, and also on Medicaid that you have screened for Medicare Savings Program, because you have. You just did it. There you did it.
Right.
You might as well get credit for what you did.
Right, and those not collected boxes is another change coming down the road. As of April, I understand that those not collected options on the online form for client contacts are going away. So we're going to need to have actual information for most of these areas from now on going forward. And you can see under that Medicaid one, there is line 49, Medicaid application assistance. I'm sorry, 47, MSP application assistance. So yeah, if you're actually going to have a hand in having that person get benefits, then certainly get credit where credit is due on that one as well. Let's go on to slide 30.
Yeah, so let's see, we've sort of talked about, reviewed LIS and MSP and how they work with Medicare and who's eligible and that kind of thing. And we've talked about using benefits checkup, and we've talked about tracking a little bit more. And what I'd like to talk to you about now is the rest of the MIPPA grant. And one of the best ways to launch into that is just to kind of think back to that opt-out box. Do not send information to the state. I wanted to let you know what happens when information is sent to the state, and if you want to go to the following slide. The information that Social Security gets, whether or not someone is or is not eligible for LIS, gets batched, and it gets sent to the state of Oregon once a month. Each branch gets the information, downloads it from a file each month, and part of the policy is that they are to send letters inviting the person to apply for more benefits. Doesn't matter if they're 800% federal poverty. They invite someone to apply for further benefits, and those further benefits might include SNAP or food stamps as well. Sometimes people don't reply at all to the letters. That's fine. The caseworker notes that they have sent the letter and closes it, and that's that. What this grant does, we have a staff person who will be doing pretty much dedicating her whole time to following up 30 days after the letter is sent, you know, giving it about 30 days, and then looking in the file, looking to see if someone has applied or has not, has gotten a letter but hasn't responded or hasn't followed up. And then what we will be doing is sending a letter saying we're going to be contacting you in a week to see if there's any way that we can assist you in finding out about further benefits, and seeing if we can go forth from there and help people to apply for a Medicare Savings Program. And we don't have to call all the people who are 800% federal poverty level. We've got the same data. We do the screening so that we're pinpointing the people that look like they're eligible for MSP. We can call, and we have someone here who's got access to the state computer screens, and so basically we can do a state screening, transfer it to the Aging and People with Disabilities branch that's appropriate wherever in the state, because this is a statewide program, and that starts the 45-day clock. We let the branch know that we've sent them a screening, and voila, someone is in the system and getting ready to be screened for and applied for Medicare Savings Program. So that's another, that's a big part of what this grant is doing, is following up on what's called Social Security data leads in order to help people get Medicare Savings Programs that might be eligible. If you want to go to the next slide. Another huge part is we have a toll-free line. It is not exactly strictly an 800 line, it's an 855. Those are getting to be difficult, aren't they, trying to figure out all those. But it's called Oregon Medicare Savings Connect. We've got 2 staff people. We basically have enough of us here that we will be able to return calls within a couple of hours. But we've got staff here 9 to 5 Monday through Friday. There's an answering machine for nights and weekends, and it's being publicized by brochures and advertising, by events. There are going to be flyers in food banks. Your own outreach may be publicizing this number. What we're trying to do with this number is help people who call in real time go ahead on Benefits Checkup/Oregon to enroll in LIS. And so that's something they can directly do. We can send them back the receipt for submission, and there we are. If they are also looking to be eligible for a Medicare Savings Program, we give that information to Diana. She starts up an MSP screening, and we send that to the branch as well. Just so you know, all of our staff here would be or will be trained to refer people who need it back out to SHIBA if they need further SHIBA counseling, to the area agencies on aging if they need local help, and to the ADRCs if they need any other kind of assistance. And so it's a really good kind of synergy of the different agencies and how we can help people together. And so that's sort of how that's working together and how we hope to work with you. We realize, Donna and I, that we're talking to our SHIBA folks, and you're seasoned veterans. You've been doing this for a long time. You already know that what you do gives people a lot of relief and a lot of support in order to just get through their daily lives, get the plans that they need, get the health care that they need. You're giving them hope. If you're able to give them further information that might help them get newer benefits, you're giving them further options, because if they qualify for these benefits, they've got that continuous special enrollment period so they can change if they need to. And as you help us with this tracking that we're asking for, you're helping us prove the good work that everybody in the state here is doing. The Oregon Medicare Savings Connect line is something, let's see, I've just turned my page over wrong and I shouldn't have done that. If you want to go to the next slide. When to refer clients, when you don't have enough time remaining in your SHIBA appointment to enroll your client, that line is there to support you. If you're at an outreach event or at another venue where you don't have an internet connection, you can have someone call the 855 line. and they can help someone sign up on benefits checkup. If your client needs encouragement and coaching to get some information like, gosh, I'm really not sure I can get my bank statement, there may be a way that we can do a three-way call and help someone request something, or something that you may not be able to do for one reason or another. And there are some situations in which phone contact works better for a client. That's sort of where we were with that. Were this a live webinar, we'd be going to the next slide in which we were asking for questions. But so Anna, if you want to go ahead and go past that, because we can't take your live questions right now. But Donna, where are we?
Well, I just wanted to make a point that 855 number is going to be a real valuable resource for the folks that want to apply, because it is going to be specific to getting folks benefits that they may be entitled to. So I'm just really pleased that that's available, and thank you, Janet, for getting that set up so that it can add to our tools in our tool belt for folks who may want to apply, may want to do it, via their own home rather than coming into a SHIBA appointment. So, good stuff. If you do have any other questions, and we didn't answer them in this webinar, you may write them to either Janet or I. My name is Donna Delacat, and the email address is donna.delacat@state.or.us. I'm going to repeat, Donna, D-O-N-N-A, Delacat, D-E-L-I-K-A-T, at state.or.us. And Janet, you want to give your email address?
Sure, and also, I guess, Sue Ann, I think there's one other handout. If you wanted to bring that up, that's something we could look at just briefly too. If you want to get hold of me, my email address is Janet, J-A-N-E-T, .Bowman, B as in boy, O-W-M-A-N, at Multco, M-U-L-T-C-O, .us. So Janet.Bowman at Multco.us. And as you see on your screen here, this is something that went to SHIBA coordinators. You may have it. You may already have something like it. This is just sort of a reminder sheet for some of the things that you saw today. To let people know as you're speaking with them, we're trying to make information available to everyone about available benefits. Help to screen, apply by going to benefitscheckup.org/Oregon. Click Submit Your Application. The whole thing about what to click, view your submission, print the page for your records, make a copy for the client. And then collecting the data as you go down further. What we really need is that client's full name spelled exactly like it was on Social Security and the birth date. Best practice is to fax the first page to Donna. Still acceptable is to call the state SHIBA line and leave a message for Donna with that information, or call your SHIBA coordinator with that information, or collect it on a tracking sheet, either the sample one that you saw earlier or one that's provided by your coordinator, and get it back to your coordinator no later than the 10th of the month. That's something that you and your coordinator will be working out. The thing that's not acceptable is to email. Then you're going to be marking the client contact form. There's the phone number for Oregon Medicare Savings Connect, and that's just sort of a a cheat sheet on what you saw today.
And Sue Ann, if we can go back to that, thank you. Thank you, everybody, for your participation. This work would not be achievable without you. You know that. We appreciate you and the work you do. It is so important to the community that you are available to answer questions and to help people get benefits that they need. And so we are indebted to you, and we certainly appreciate all the time that you spend assisting clients on behalf of all of us at the state office. And We hope you enjoyed this webinar. If you have questions, please let us know.
Oh, and the other thing, Donna, that you were going to mention to people about emailing you?
Oh, yes. If you attended this webinar, please send me your name and let me know that you attended it and the date you attended it, so you can get recertification credit hours, and we will allow you an hour and a half or 2 hours of recertification credit for attending this webinar, and we really appreciate your taking part. Thanks, Janet.
You bet. And I add my thanks to Donna. Thanks for your time and skill. You're wonderful.